In Nokajjar, where I grew up on Java, people had a great deal of fun at the expense of the local town fool, Dul, a schizophrenic wandering the streets and marketplace. But in Indonesia, there is nothing funny about mental health. When I finally toured the one and only insane asylum in Banda Aceh serving the 5 million Acehnese, I saw just what I expected to see. I could not send my worst enemy to this asylum. There were 220 beds for 317 patients. The patients had no running water as all 9 wells were contaminated by the tsunami. The hospital was staffed by 1 overworked psychiatrist, 2 part-time psychiatrists, and about 100 regular nurses. There was no therapy, although patients could learn Muslim prayers. Some of these barren locked rooms had over 30 people crowded behind bars. This was the only mental health service available for the tsunami victims. Mental health care at home was not much better. It was quite common to simply chain the person to the wall. We counseled a number of severe schizophrenics so chained who sadly reminded me of Dul.
Ini sudah berapa lama dia ditaruh rumah sini?
Ini?
Iya.
Ini sekitar 2 bulan.
2 bulan?
Ya.
Obatnya hilang?
Obatnya hilang.
This young man living in the hut on Chalang Beach kept impulsively running off at people's stuff. He'd been chained up for 2 months in a hut right on the ocean where the tsunami came ashore. So this was the system waiting for the survivors of the tsunami. A nut house or chains on a beach in a hut. Tsunami traumatized Acehnese I met exhibited the same complex of 5 feelings.
Apa yang dikatakan oleh bisikan-bisikan itu?
Oh ya, pegahnya dia bisikan, bisikannya Pak Puyung lagi.
Many lost 9 out of 10 family and community members. In some communities, there were not enough survivors to bury the dead. Here, in the war zone, we visit a woman, a manic depressive, chained in her house. Dr. Lynn Jones thought we had a prayer if we could just get the mental health system up and running within the socialized medicine health clinics of Aceh. Remembering, of course, that the health clinics are in a war zone where the soldiers may at any point decide to cast out all the humanitarian aid workers in Aceh.
I understand you would like to get some medicine.
This chained man, Buktar, killed a man in a mosque. We saw he had written all over the walls of his room with his feces. Psychotic, my nurse started him on haloperidol, a strong antipsychotic medication. 2 weeks later, he was lucid enough to do his Muslim prayers and write poetry. We promised to bring him in bed if he would stop writing on the wall with his feces. So he started tearing out paper letters instead. He even scrubbed down his walls. So we brought him to bed and asked him about the chain. Buktar told us he deserved the chain. He explained that the chain was just reward for killing a man, reminding us that there were many chained people in Neraka, hell. He was resigned to spend eternity in chains.
Kind of stress? Because of stress, people say.
Was he screaming and shouting?
Yeah, he was screaming and bothering people.
Aggressive with people?
He killed somebody.
He killed somebody. How long ago was that?
Kapan dia membunuh orang? 16 years ago.
Balas dendam.
Apa?
Balas dendam.
Orang balas dendam. It was a
Did he
revenge
go to
thing.
jail?
Apa
Was he
dipenjarakan?
arrested?
Abang, ada
Yeah.
mama kasih ke penjara.
There were those who said he should go to jail.
And
Habis itu disuruh bawa ke rumah sakit jiwa.
But they took him to the mental hospital and took him to the judge, and the judge okayed the committal.
And how long was he in the mental hospital?
Berapa lama dia di rumah sakit jiwa?
Waktu itu
Every year he had to go
sekarang
back.
lampu lagi.
Berapa tahun kira-kira?
pokoknya 2 tahun masa kedua nanti pulang tahun kampung kamu lagi bawa lagi gitu.
So he was there for 2 years, and then they were allowed to bring him home for a year, but they have to take him back every year.
Okay, I'm going to ask you a question that is very strange, but I'm going to ask it anyway.
Saya akan menanyakan sesuatu yang aneh, tapi akan saya tanyakan.
When he killed someone, was he crazy or was he angry?
Pada waktu dia membunuh orang itu, apa dia gila atau dia memangnya marah?
Gila.
Crazy. It was a revenge thing.
Orang tuanya sama dia lagi.
This person had beat his parents and his big brother.
And was he angry when that happened?
Apakah dia marah pada waktu itu?
Enggak marah, baik-baik.
No, he wasn't. He was very sane and fine.
Malah sebelum dia bunuh orang itu udah telepon sama wartawan bilang hari Jumat jam segini ada dia membunuh seorang di masjid bilang.
He called a reporter and said, "I'm going to kill this guy on Friday in the mosque."
Yeah? And why was he not arrested?
Kenapa itu dibawa sama polisi?
Ada dibawa.
He was arrested.
Dia
How long was he in jail for?
Berapa lama dia ditahan di penjara? He was
ada
held.
seminggu.
1 week in
Bawa
jail.
ke sana.
They said that they wanted to take him to the mental hospital after 1 week in jail.
How long has he been ill? His mental health problem.
Jadi sudah berapa lama dia sakit? 15 years or more.
How long has he been chained?
Jadi dia sudah di rantai berapa lama?
Why did you decide to chain him in your house?
Kenapa terus di rantai di rumah?
Karena mengganggu orang.
Because he's disturbing the peace.
The Aceh psychosocial program was kindly led by psychosocial coordinator Susie Morrison. She came to Aceh from East Timor after surviving to tell of thousands of deaths, body hanging in trees, rapes, and other acts of terror. Susie was a skilled administrator with a big heart. In addition to providing desperately needed counseling to over 400,000 people displaced by the tsunami, Susie set out with the intent, shared by the World Health Organization, of making mental health an integral part of the reconstructed public health delivery system. The dream was to provide emergency mental health services in a community mental health system where only one solitary state asylum existed before. The IMC goal was to have it become part of the Ministry of Health in 1 or 2 more years. IMC worked hard to make sure the system would not evaporate when international experts went home. When I first came in April, Dr. Jones took the West Coast, Susie took Banda Aceh, and I was assigned to the North Coast.